Hello, I'm Tiana and this is Chase, and we're going to be talking about our Flash Talk presentation for the SNF. So currently, right now, I'm doing my externship placement at Westmoreland Care and Rehabilitation Center, which is a SNF. And so my typical work day is at 8:30 a.m. I arrive and I'll look over the daily log sheet. So I'll see who all's scheduled for that day and I'll check if there's any like progress reports due, which we have to do those weekly just for the insurance company to be updated and to know like why we're doing treatment for them to make sure that they can still qualify to receive services. So if we have any progress reports due, I usually do that from 8:45 to 9:30. And then from 9:30 to 12, I'll do mostly my cognitive patients, which right now we have seven on caseload in general. So we have like six cog patients, and I see them each for like 30 minutes. And then from 12 to 12:30, I'll do my swallowing therapy during lunch with a client in the dining room. So we're working on like compensatory strategies. So like slow rate, taking small bites, hard throat clear slash re-swallow, and then alternating liquids and solids to make sure that they're safely swallowing. And then I'll take my lunch from like 12:30 to 12:45. Some days it's shorter, some days it's longer. It really just depends on like my caseload that day. And then after that, I'll resume sessions with my remaining clients, but it takes about another hour, hour and a half. It just really varies. And then from 2 to 3, I'll complete all my documentation that needs to be done for that day and then do evaluations if that needs to be done. And then we have a medical complex client, so it's a voice and swallowing. She currently has a trach, and so we've been working with the PMV valve and using a red cap to help her like speak properly. And she just now got upgraded to parade diet trials, so we've been working on that. And then from 4 to 4:30, which is my last 30 minutes of the day, I'll finalize documentation, submit notes for signatures, and then prepare materials for the next day. So normally my caseload, like I've said, is cognitive communication disorders. So my goals have mainly been on safety awareness, problem solving, sequencing, attention to task. Then I have swallowing disorders, which is like mealtime therapy, PO trials. And then as I mentioned before, the compensatory strategies. I've had a couple language disorders, working on expressive and receptive language. And then I have some voice clients. So I've been working on vocal fold paralysis, dysphonia, and then like putting breath control and speaking on exhalation. So mainly most of my day is spent doing treatment with the clients rather than like documentation and evaluation. So like I mentioned before, it's like 1 to 1.5 hours per day is like documentation. Some days it can be 4 to 5 depending on if we have more referrals that day for evaluations. Progress reports is completed early in the morning. And then usually my planning for the day is done in the mornings when I arrive or at the end of the day. It just really varies from day to day and what we have to do that day.
All right, so I'm going to talk a bit about the interprofessional experiences that a speech therapist could encounter at a skilled nursing facility. Now, granted, I don't have the experience myself because I'm not in my placement yet, but I did do, I think, a good fair amount of research on this. So I'm going to kind of dive into these and discuss what those collaborations look like and how they kind of manifest in the daily schedule of a therapist there. So I think really in any setting, probably one of the most recognized and familiar interprofessional relationships we have are with the OTs, with the occupational therapists. Um, and so at a skilled nursing facility, those relationships pretty much they manifest in a way of coordinating goals, really relating to dysphagia, which is a big exceptionality at these facilities and those other various swallowing safety concerns. As they do at other facilities and locations as well, they address those fine motor concerns, specifically relating back to the dysphagia portion in the previous bullet point, that aid in that self-feeding, so kind of help that safe swallowing and feeding. Um, and then there may be opportunities for co-treatment, especially if places maybe have more adaptive equipment for that safe feeding. It could be a joint effort between the OT and the speech therapist to make sure there's no communication concerns when you're assisting patients on how to utilize those materials. Another common one that we see in a lot of facilities and locations are physical therapists. So, when it's appropriate, when it's necessary or pertinent, they can play a role in aspects in that dysphagia treatment as well. Could be with the OTs as well, could be solo with you as the speech therapist. Um, so it's that dysphagia treatment as well as the general safety of patients if their mobility is hindered, if it's impacted from getting to point A to point B, or whether it's trying to enhance their participation in activities of daily living. Physical therapists can play a role in that. And obviously, communication from the speech therapist perspective and for everyone is a big part of what we do. So that's an important aspect. And then for physical therapists as well, there's an opportunity for more collaboration when treating individuals with conditions such as Parkinson's or ALS, wherein both speech and motor function is affected. It's kind of a reasonable conclusion to make where a speech therapist and a physical therapist may be co-treating. Um, Maybe the one that isn't as familiar to therapists that have only worked in school settings like myself are nurses and certified nursing assistants, CNAs. Um, so this is the part where I had to do a bit more research on, part that I maybe wasn't so familiar about, but they can help assisting with the mental status of patients, ensuring appropriate communication between the medical professionals and the patients and their clients and also assisting with the tracking of swallowing concerns during meal times. Um, I think it was important. The thing that I gleaned the most from reading about this online was that, at the end of the day, while they may be the experts certainly on maybe the medical vital sides of what they do, we have a really important role and an important say in how we manage our patients in terms of dysphagia and swallowing and communication. And I think I read a lot of personal anecdotes online talking about how some therapists, when they start, might feel kind of intimidated because they're not doctors or nurses to kind of speak up, but I think that's an important thing for us to keep in mind if we are to work at one of these facilities. Um, Another one that I was not familiar with, dietitians. And while there's only one bullet point here, it's still an important factor of what we do. And so for patients on modified diets, their assistance may be required when you're managing diets and meal plans. And again, not to say that they are the sole uh, person in charge for this, but they certainly collaboration when you're handling a large caseload and you're handling complicated caseloads and patients. The assistance from an outside source or another viewpoint could be important. And then the big one, perhaps, are physicians. So they will help you guide and assist with those overarching treatment plans. And then maybe one of the most important roles is helping to obtain referrals and facilitate those when necessary and when that need arises. All right, so the pros and cons. This is again maybe a bit subjective for some people, perhaps, but I think there's a general consensus that these concerns are shared. These concerns and positives are shared. So I'll start with the pros side. So for the pros, there is an opportunity for watching patients make those long-term gains. Due to the extended periods of placements, they have a better opportunity to view patient growth and to establish a rewarding rapport with those patients. There's a high, generally, obviously it depends on the area, but there is a high job availability for SLPs in those skilled nursing facilities with flexible scheduling. There is a wide-ranging caseload, so clinicians within this setting are able to work with a wide range of exceptionalities, most notably aphasia, cognitive communication disorders, and dysphagia, those of which aren't generally seen pretty much ever always, but in a school-based setting, those generally are not exceptionalities that are worked with. And as I say on the last slide, there's an increased opportunity for collaboration with PTs, OTs, and physicians, and you're able to garner a more overarching knowledge base of patient care. And then a functional goal focus, which I thought was an interesting viewpoint to take on this, which is a sentiment that I found shared online from other therapists, is that many SLPs within these facilities work on concepts and activities that focus on improving daily life skills, allowing their patients to better participate in activities of daily living, as well as finding more enjoyment out of life. And I just found this interesting that In a school setting like myself, we're working on artic and expressive language and receptive language, but we're not really focusing on those daily life skill type goals. And it was interesting to think about how that would be a pretty rewarding thing to do. So I just thought that was interesting. Cons, as every job site may have, the cons for this site are there may be limited resources depending on where your facility is. They may lack the most up-to-date therapy materials and assessments, as well as not having adequate space to perform speech therapy effectively. Um, there are some high expectations, like a lot of medical settings where there's productivity standards and guidelines. SLPs may be required to meet strict productivity goals and quotas, as well as being burdened with larger size caseloads. Obviously, this is not a one size fits all con, but this could be seen. And then a medically fragile caseload. So individuals on caseloads, they may suffer from conditions that significantly inhibit them or may be near end of life, leading to an emotionally taxing daily work life, which is a pretty stark contrast from maybe a SLPA who's working at an elementary school. Um,
So next we have our resources. And so like I said, I'm in my externship placement now, and these websites or books is what I use daily. So it's called Restore Skills, and it's a digital therapy platform, and it's often used by SLPs to support cognitive communication rehabilitation. So it's interactive games based on activities that can do attention, memory, problem solving, sequencing. So they have like matching, like grocery hubs. You have to like find like the places in the grocery, like where you would find like bread, eggs, just to help like with sequencing, medication management, and then kitchen mixing is where they sequence recipes. So these really stimulate real life scenarios that they may face back out in the real world once they get done with rehab. And they have OT and PT on there as well. So the next thing that I really use is the adult speech therapy workbook. It is something you have to pay for, so it's not always feasible for everyone to have, but it provides printable evidence-based worksheets for adult populations, and it includes a variety of places, so like dysphagia, memory, problem solving, and voice is what I use it mainly for. So it's like a grab and go resource. It's like just a book, a pamphlet. You grab it and you just take it and you can work with the client. So it's really like client centered and something that they may face once they get back in the real world. And then one of the ones I think is the most important is the IDDSI framework website. So this is the type of diet textures that most nursing facilities will implement, and so on there it has the level worksheet, which is like 1 through 7. So it's like from severe dysphagia all the way up to like modified independence with dysphagia. So they're able to eat regular texture foods. And so this helps with like knowing what to tell the kitchen staff, nurses, and caregivers when you are changing their diet textures. And yeah, I think that's all we had for today. Is there anything else you need to add, Chase?
I think you did a nice job on that last slide. I think it's good.